Hello, Sherry Ann Lee. I work in a technologist here.
Hi, my name is Dr. Catherine Fitch. So you brought an interpreter here with you today?
Yes, I did.
Fitch, I'm calling Kepler.
Have you worked with an interpreter before? Okay. I'm going to sit behind you so you won't see me, and she'll be watching me most of the time. You can talk directly to her, to Sharina. You don't have to say tell her or she, just talk directly and pretend I'm not here. Don't worry about the lack of eye contact. As hearing people, sometimes we want to have that contact and say, like, look at me, look at me. She'll be watching the interpreter most of the time. So just go ahead and everything will be smooth in a few minutes. So great. Have you worked with Holly before? No? Okay, fine. So tell me what the problem brings you here today. I have a really sore throat. It's been about a week. Do you have other symptoms, like of a cold, anything along with a sore throat? No, I've just been eating less. Do you have a fever? Nope. Do you notice if you have any like swelling in your neck area? Honestly, I don't know. Your nose, does it feel normal, or do you have like a post-nasal, like a drip that comes from your nose? Or do you have any breathing problems? No, nothing like that. Do you have nausea, vomiting, diarrhea? Nope. That's good. So now I'm going to ask you about your past history. All right. Do you have major health problems like asthma, diabetes, or high blood pressure? Nope. Good. Have you ever had surgery before? No. Are you taking any kind of medicine right now? Like over-the-counter stuff, I guess, like NyQuil, you know? Do you take birth control? No. Are you allergic to any kind of medicines? Yes. Penicillin? After you take penicillin, what happens? What reactions do you get from penicillin? Like a rash, swelling. I kind of blow up, like normally in my face. Before you go to the dentist, do you have to take an antibiotic? No. You married? Yes, I am. Do you have children? No children. Your husband or the people you work with sick? Yeah, I think it was actually one of my coworkers that gave it to me. So now I'm going to examine you. I'm going to do everything in the same order so I don't forget. So first I'm going to look at your ears. Alright, that's fine. So before I start, were you born deaf or did you become deaf later in life? I became deaf later. How old were you? I was 3. Do you have any hearing at all? Can you hear anything? Yeah, if I have hearing aids in, I can hear. You wearing them now? Yes, I am. Okay, so I'm gonna have you take them off, and then I can examine you, and then you can put them back in when I'm done. All right. Your ears look very good. You can put your hearing aids back in. Now I'm going to examine your neck now. Can you swallow, please? I know it's very sore, I'm sorry. You have very small lymph nodes, which it's tend to be normal with a sore throat. This is my headlight. I use it so I can see better. I'm going to look into your nose first. Your nose looks very good as well, inside and the outside. Can you open your mouth, please? Now I'm going to look deeper into your throat. You might gag a little bit. Okay, open and relax your tongue. Good. Next, I'm going to take like a throat culture. It won't really feel good in the back of your throat. I apologize in advance. I'm going to try to make this as easy as possible. Okay. Are you okay? Yeah. If we're too gentle, we don't get a very good culture. There's a myth that if we see a strep throat, we'll know it's a strep throat just by looking at it. I don't know whether it's strep or not. And that's why I took culture. So you've had these problems for a week, right? Is it better or worse now? It's becoming worse. When a person has an infection for a whole week and it doesn't get better, I tend to still treat them even if the culture is negative. The culture is just another way to help me in case there's another bacteria there. So normally we use penicillin for sore throats, but not with you. So we will use erythromycin. Have you had that before? No, I haven't. Sometimes it can cause an upset stomach, so I'll prescribe a more expensive kind that is less likely to upset your stomach. Okay? I want you to take it 3 times a day with food. Alright? The instructions should be on the bottle. If any reactions happen, please call me. Okay? If you have like a mild stomach ache or mild diarrhea, just be patient. But anything worse than that, you need to call me. Okay. You're not pregnant or trying to become pregnant right now, are you? The medicine you're going to take is safe for pregnancy, but I ask all women of your age that question. Make sure you take it for all 10 days. I have to take it every day? Yes, because if you don't, the bacteria may develop a resistance and the medicine won't be as effective. Oh, okay. And if you stop before the 10 days, the infection could come back. At the end of the 10 days and the infection's not gone and there's new symptoms, let me know. Okay, I will. Do you have any questions or concerns? No. It's been a pleasure meeting you. Please come back if you have any more problems. Thank you.